Good evening, Malden. I'm Gary Christenson, Mayor of the City of Malden, and unfortunately, we are back with another update on COVID-19, or should I say, tonight will be all about the Delta variant. And we could not have this discussion without our panelists. We have Chris Webb, the Director of our Health Department. We also have Scune Carrington, who is with the Board of Health, and of course, Christian Lanfair from the Cambridge Health Alliance. None of this is possible, no matter how many panelists we have, without the services of Urban Media Arts, formerly known as Malden Access Television, along with our communications director for the City of Malden, Ron Cochran. So if you want to participate via social media, you can ask your questions via YouTube, Facebook. I'm not sure if TikTok can be done, but Ron Cochran's monitoring, and we'll try to get all of your questions answered this evening. We also have the ability for you to call in. So if you'd like to talk with us live, you can do so by calling 781-388-9394. So as we do at this point, let's just get some introductory comments from our panelists, and then let's get into this evening's questions. Let's start with Mr. Webb.
Good evening, everybody. My name is Chris Webb. I'm Director of Public Health for the City of Malden. Things are going well. They could be going better, and we'll cover some of those topics tonight and our plans for the future. So just in case anybody wants to get a hold of me, you can reach me at cwebb, W-E-B-B, at cityofmalden, all one word, .org, or call 781-397-7049.
Very good. Thank you, Chris. Over to Scune.
Good evening, City of Malden. Thank you for those of you that have tuned in. I am Scune Carrington. I am one of the members of the Board of Health and looking forward to some of your questions. And in order for you to reach me, my email is bohresponse@cityofmalden.org. Looking forward to your questions.
Okay, thank you. And finally, Christian Lanfair.
Good evening, Malden. And I just want to thank the mayor for inviting me back for another edition. So my name is Christian Lanfair, and I am with the Cambridge Health Alliance system. I'm responsible for our COVID program for the 2 acute care hospitals. And tonight I can be reached at 617-665-1000. Thank you.
Thank you. And I think we first, Mr. Cochran, addressed the question that everybody's been asking, which is, are vaccinated people protected against the Delta variant? Start with you, Mr. Webb. What is your take?
Yes, they are. There may be varying degrees of protection based on when you last were vaccinated. If you're still within the 2-week window after, of course, you're waiting for your immunity to build. And it builds for a little while after the 2-week window as well. So it depends on when you were last vaccinated. I was vaccinated in March. I'm pretty comfortable. I've got at least a good 80% left from what I can tell. The boosters are recommended, but not for someone like me. I don't even know that we're going to be able to call these boosters. I would call these a supplemental vaccination for the immunosuppressed and people with other underlying health conditions.
Okay. Scune, are vaccinated people protected? What say you?
So protected means, yes, they are from like the worst of the virus. So like hospitalization and some of the things that we're worried about that basically overwhelm the hospital system, they are protected from those. So I think for the most part, the vaccines are doing what they're supposed to when you have gotten, fully vaccinated status from the Delta variant. But we do know from the studies that's been released that it's the immunity that you do have start to wean off a little bit. But for the most part, you are protected from the worst of the virus, like that will lead to death and hospitalization.
Okay, and Mr. Lanfair, do you agree with both panelists that the vaccinated people are in a better position against the variant?
They absolutely are. And I'm going to take a different take on this.
Okay.
So this morning, each of the 6 regions in Massachusetts each of the hospitals have been coming together to discuss, the volume of patients. And In today's meeting, this is including all of the Boston tertiary care hospitals, all of the community hospitals, as far south as South Shore Hospital, up to the Everett Hospital, and as far west as the Marlborough Hospital today. Not a single patient that has been vaccinated is in the ICU. If there are any vaccinated patients in the hospital, there are about 11 of them. And this includes all of these institutions. Many of them are there for other medical reasons. What we do have in every single ICU in Eastern Massachusetts is anyone in the ICU who has COVID is unvaccinated. So hear from me that I can tell you right now that these vaccines do work. Just by the sheer, just without having any scientific knowledge, just looking at the cases in our acute care system, these vaccines are working.
And Christian, it's a good take on explaining what you're seeing, because in our conversation last week with the state, we were asking them what they recommend for us going forward. Do we revisit all the protocols we had in place last fall? Masking indoors, outdoors, certain times, certain days, and their recommendation back is just get the unvaccinated vaccinated. So they're seeing the same thing as you are at the state level as well. So another question that Mr. Cochran and I have been asked, what is a breakthrough infection? So Christian just mentioned that most of the people are unvaccinated, but there were a few that were vaccinated. So therefore, can you explain to the audience, we'll start with Chris, what exactly is a breakthrough infection?
A breakthrough infection is when you're fully vaccinated and yet you still are test positive. Now, that's the initial stage. You'll test positive. You may get sick, but you may have all of the symptoms, the nausea, the flu-like symptoms. That's where you're going to be. You're not going to be in the emergency room, and you're not going to be in the intensive care unit. You're going to test positive. You're going to be in quarantine, and you're going to be drinking liquid and taking aspirin until you feel better. Some people have a very quick turnaround, a day. I've heard a day, I've heard 7 days, but I haven't heard anything past that. There are people who have a breakthrough infection and do end up in the hospital. But like Christian said, it's usually some other underlying medical condition that's exacerbated by them being ill. They can't take aspirin for some reason. So it's going to feel worse, and they're going to appear at the hospital, but they're probably going to be sent home in the day.
These breakthrough infections, Christian, are they all caused by the Delta variant?
So we believe, we haven't done genome sequencing on all these patients, but given their clinical presentation, we do believe that the patients who are coming to the hospital likely have the Delta variant.
Okay. And Scune, do you think masks, based on what you're hearing and seeing, can help prevent these these breakthrough infections?
Absolutely. It's one of the best ways because it goes from, the way that we know that this virus is transmitted, definitely masking, especially if you are in an area where there is high level of transmission, definitely. It's one of the ways that you could reduce that breakthrough infection.
Okay. Let me pause here to check with Mr. Cochran to see if we have anything in the queue, because he knows I'll just keep going on and on and on. So Ron, anybody calling in or any questions via social media?
We do, actually. Before we get to that, I just want to let you know that we're on facebook.com/City of Malden. We're monitoring our inbox messages there, as well as the thread that advertised this show tonight. And that's where we'll take our first question from. And then I'm also taking a look at the UMA stream on YouTube, which I see a few questions that are going to be there. So yeah, there's several that are in the pipeline here. So I'd like to go ahead and get them asked. But before that, we want to remind people, though, too, for those that aren't necessarily social media savvy or don't want to ask via that, we again are taking calls live in studio that we'll relay to the panel, and that's by calling 781-388-9394. So our first question with respect to the Facebook submissions was on businesses. And one of our residents pointed out that there was a neighboring city, which I won't mention the name of it, that went pretty hard and severe with restrictions right away on the businesses. Is Malden intending on doing the same? If not, or if so, why or why not?
Maybe I shouldn't have turned it over to you. That is one of the questions of the day that we are all discussing internally, right, Mr. Webb? I mean,
Yes.
we're hoping not to, but it's going to be all what the numbers tell us, right, Chris?
Yes. Ultimately, that's really all we have to go on is the science or the math. Some other communities that went earlier than us are looking at different metrics than we would. And their previous infection rates were usually much lower than ours would have been. So they got a bump up. And I think a lot of the bump we're seeing right now is college kids going back to school, people going back to work. It seems that category is where the age range is where the positive testing is coming through. So it only makes sense. And they rightfully got a good spike and did the right thing, in my opinion. We have different metrics that we look at. We had a very tough time in the very beginning, so our metrics go a little bit different than theirs. And while we have our concerns, we have time to make good, strong decisions, talk to the groups that we have to find out what the best way going forward would be for everybody, and then act. That's, I don't see as a big process. Everybody out there knows generally what would happen, and we could curtail some things and make some other things more strict than they were in the past, and less strict than they were in the past. So it's a whole bunch of things. We've talked, we're getting close as far as planning goes. Just don't know when we're going to need to pull the trigger just yet.
Yep, and our next panelist, Scune, it should be noted to the public, was here in City Hall last week with her fellow members in the Board of Health, ready to do whatever is necessary to help our city. So let me go to Scune on whether or not you think we're there yet.
I think similar to what Chris mentioned, I think we are looking at essentially the different numbers, the science, the infection rate, and just really make the most informed decision to not only just protect the city, but also looking at, the best way to move forward is to just kind of listening to the science. So I think we have a lot of data at our disposal, and just, work together with the stakeholders we need to and make the best decision for the city. So at this very moment, I don't think we are there yet, but we are going to keep looking at the fall and just see what happens.
All right, very good. Mr. Lanfair?
Well, I think everyone will know right now, every hospital in Massachusetts, a mask is required for anyone who enters any acute care or nursing home. So for us, they have been working. I think it's up to each jurisdiction to determine for themselves, what's appropriate and when, based on their numbers. I think every little town is just, they've got something a little different that I think that they have to contend with.
Yeah, and you know what? That's a good segue, Christian, because in talking with the state, I'm probably going to repeat this a few times this evening. When I asked about whether or not we should go down the road that we went last fall, the secretary told me, vaccinate, vaccinate, vaccinate. That is the key going forward. So these other protocols, if you think they're needed, put them in place, but ultimately it's going to come down to increasing the percentage from unvaccinated to vaccinated from her vantage point. This was Secretary Mary Lou Sutters of Health and Human Services, who was great on the phone. I mean, really good advice. And sent me over numbers that confirmed with what all of you said, that most of the people right now that are churning up positive and or are being hospitalized are those that are unvaccinated. So she had the global view of what's happening across the state, and it matches up to what Christian had said. So, all right, back to Mr. Cochran. So I guess the bottom line, Ron, is, stay tuned. We're not there yet, but we are closely monitoring the numbers.
Yeah, I think it's the most common thing that we see. And, that's just from our residents who astutely understand, that it impacts how they enjoy, the downtown and other areas in Malden. But of course, our business owners themselves have been beating that drum for a long time. And I think it speaks to the partnership that we have with our businesses from this office as to we really have our finger on the pulse of what's going on. So that's kudos to all involved.
And Ron, while we debate this question, I think Chris has said this repeatedly in the past, you can take measures yourself, until a decision is reached that meets your expectations. I mean, we've been through this now a couple of years, and I think there are a number of protocols out there that don't require any legislation or, anything from a board or a commission. You can do them now. So, Chris, I think that's worth repeating, right? That if people aren't comfortable,
they make anybody, it's just as you said, sir. We had 5,452, I believe the number is, 5,542 people tested last week. Why? Why weren't they getting vaccinated? I mean, some of that percentage, some small percentage of that are going to be people who were vaccinated and may have been identified as a close contact or something. Then I understand that. But the majority of them are people who have just dipping their toe in the water and just waiting their turn, I guess, to go to the ICU. I don't know, but they really need to buckle down. And the reality is Pfizer is approved. It is safe. It's as safe as it's ever going to be. And it saves lives, period. There's no debating that. I don't know how you could look at any of the figures out there and think otherwise. So stop getting tested, get vaccinated, because the United States government just turned over to the armed forces. They're all going to get vaccinated. Large corporations, meatpacking, all of the wholesalers around the country are going to go that way next. And then the retailers will go. And you're leaving yourself out of work longer than you need to, because not everybody's going to be able to get a J&J and go to work in 2 weeks. Keep in mind, you have almost a month, 28 days of vaccination time before you can report to work, to be fully vaccinated at work. So the caution to the wind if you want to, but I would suggest if you want to get back to normal, that you factor in all of those things, but get vaccinated no matter what. Even if it's one shot, if you take one and you can't do the next one, it's just physically impossible, take the one.
Chris, let me stay with you real quickly. Are some vaccines working better than others against the variant?
Against the variant, there's nothing that really out about J&J per se. It's high. They do say it's high. That's all I've heard is high. It's similar to their initial outlay, somewhere in the 90s. The other two, we now know it tapers over time. So again, based on how you're built, what your comorbidities are, everybody's going to be a little bit different. But generally speaking, if you're vaccinated, one dose, you're not going into the ICU. And focus on that, really. No time like the present. There are no lines. Registration is a breeze. I can't imagine that the folks who did it early on could tell people today what it was like standing in line with 700 people and still getting in and out of there in 20 minutes, which I thought was a great deal. Evidently wasn't good enough. Now you can make an appointment, get in and out on your schedule, but do that. Just get vaccinated.
All right, back to the studio. Ron?
Yeah, we're going to stay with that actually for Chris. There was a question came in via Facebook about what Malden's vaccination rate or percentage is right now.
So Chris, why don't we first go with the fully vaccinated?
Hey, I happen to have those numbers handy, wouldn't you know? Okay, 12 to 15-year-olds, 46.6% of the population is vaccinated. 16 to 19, 58.7. 20 to 29, 67.1. 30 to 49, 75%. 50 to 64, 77.7%. 65 to 74, 87.9, and 75 and older, 84.2 are fully vaccinated.
Okay, and so the overall fully vax rate of our community is?
Oh, that's a great question. I haven't done the math on that one, but it averages. Let me think a sec.
Last you told me it was in the 60s.
We're at the last measure 67.4. I'm sorry. I do the
67.4.
Yes.
Okay, let me stop you there, Chris. Let me jump to Christian and over to Scune as well. Now that you've heard those official numbers from our health director, and when were those as of, Chris?
August 10th.
August 10th. Christian, what's your reaction to those? Is it what you thought they would be or hoped they would be?
So I think you guys are doing good, but I think we got to keep going. We have to, especially with the younger population, we are seeing more and more pediatric patients now who are coming into an emergency department with COVID-related symptoms, and we didn't see them. We did not see. We saw maybe one kid out of every 1,000 patients, but now we're seeing more and more kids. So we've got to protect the kids.
When you say kids, what's the age group you're referring to?
We're seeing kids under 15 years of age.
Okay.
We're seeing
Who are
small
not
kids
yet,
as well.
who are not yet eligible for the most part, right?
So the 12, 13, and 14-year-olds who are eligible should be getting vaccinated. It's the younger than 12 who don't have the opportunity to get vaccinated who are also getting sick. And I think that in the spring, when we were, trying to protect grandma, now we have to protect our kids. And so really this, the burden of this pandemic really now rests on the shoulders of the unvaccinated. And we need them to step up and help do their part so that the country can continue to keep moving.
Okay. Scune, what did you think after hearing those percentages?
So I think we're definitely moving in the right direction. I'm looking forward to the day where we would be 80% or above. And so for, the age groups where we are still in the 70s and the 67.4, I'm looking forward to the day where we could move that just inching closer to 80 or more. Again, with the Delta variant and just how transmissible it is and how, it's a little bit more intense than the other strains that we've had, and try to get as many people as protected as possible. And so like Christian mentioned, do your part. And if there are any resistance or issues regarding taking the vaccine, so whatever information that you need to help you make the best decision. Again, talk to your healthcare providers, talk to the people that have taken the vaccine. Call me at the Board of Health. I'm happy to just sit and be like, this was my experience and here is what it is. And if you have anxiety around needles, which I have heard those cases, our family members be like, I will pass out. I don't want needles near me. So it's like, what are some of the other ways where we could work to really get you to that point? And so I want us to get to 80. Mayor Christenson.
All right, very good, Scune. I like that. And credit to you and Chris. We should let our viewers know that to try and address what Christian talked about, the younger population, Chris, you will be offering vaccination clinics in partnership with the Malden Public Schools every Friday from the outset of the school year until further notice. Is that correct?
That's correct.
Can you tell the public the time and the logistics that you're thinking of?
So I don't have that information.
Oh, no, this is for Chris.
Oh, for Chris.
Yeah.
Yeah, Christian's on the other program.
Yeah.
The school program, we're working with Jamil and Kathy Betts, and we've got our first date is September 24th, and we're going to start at the high school. The whole schedule will be rolled out. I mean, it's tentative for the start of the 24th. We don't see that date changing. The dates thereafter are still being made, set in concrete. And the process, we have another meeting this Friday morning. The nurses are, the public health nurses are in on those calls so that I don't make any blockheaded decisions all by myself. So they've done really the yeoman's work, and it looks like it's going to go very, very smoothly. It's very impressive that you know, our vaccination rates in our younger groups are decent because people really haven't had a lot of time to make that decision. The Pfizer was the only option, and that's pretty recent. And they're waiting to see what the rules are. I know there's a lot of do I have to, don't I have to, depending on what people are doing with the rest of their lives. But there's another thing I want people to know. By the end of next week, we should be very close to 70%. We have 70% of our population, 70.7% is vaccinated with one dose. So we're moving in the right direction. It does take time now for people to sit down and say, do I want to be that guy that my family's visiting in the hospital because I held this position for whatever reason? Probably not, would be my guess. And if just for that alone. But we're getting there and people are getting it. And I think they're starting to make their choices. I believe Pfizer becoming fully approved today is going to be a game changer in some categories, especially amongst the young. And hopefully the African American community can embrace that. And if you need information, please let me know. And we'll be glad to get any information to anybody that wants it.
Okay, now I know people that are watching may be scratching their head over the fact that we just said a few minutes ago, we weren't quite there on a mask mandate indoors, but we do have one now as of last Thursday night for the Malden Public Schools. And again, I think the difference there is no vaccine that has been authorized as of yet for the 0 to 12 age population. So I think our thinking last week was with us being told that it's the unvaccinated that are really attracting the Delta variant. That's why we put the mask mandate in there. So as I always say, non-exact science, but that was the rationale from last week. So let me go back to Ron.
Yeah, actually, Chris covered it there. That was going to be my next question, is about FDA approval, because I know it's something that we were tracking when we last met. So maybe it's worth talking about the others, if there's a predicted timeline on J&J and the others that, as to when FDA approval can be expected.
Let's go to Christian.
So, I think it's just a matter of timing. Moderna put theirs in exactly a month after Pfizer did. So, the FDA is going through the various, their various channels. I think that Moderna has fewer plants that need to be inspected. So perhaps they might become a little faster. Pfizer has plants overseas. They have many more plants because they're a much larger organization. And Johnson & Johnson is still, they're in the process of putting theirs together. So I do predict that Moderna will probably be within the next month. They'll follow right behind Pfizer. The question is going to become, will FDA begin to grant Moderna the opportunity to go to lower age groups, just like similar to Pfizer? But I think it's just a matter of, because their applications have been put in just right behind. So I see it coming fairly quickly.
Okay. Does that answer that, Ron?
Yeah, I think that wraps that one up. There were some questions that came in over our YouTube over UMA's YouTube that had some question about vaccination hesitancy. I'll just summarize it as that. I won't get into the details of what was said because I don't see what they said as being substantiated. But what we can say is, what do you say about long-term effects of vaccine? Because I know that's something that people have pointed to as one of the chief reasons for not getting vaccine.
Let me start with Scune from the Board of Health. You hearing the same thing? And if so, what do you say to that, Scune?
I think it depends for the reason for the hesitancy. I think there's just a lot of information and also misinformation out there. And so it depends. I would always encourage people to look at your sources of information. And we do know that the vaccine does provide, robust immunity towards, the current strain right now. And you are more likely to end up in the hospital. So there's hundreds and millions of doses that has been provided, and it's going to be over a year at this moment. And so just being careful of where the source of information is coming from, but the actual science so far is, is showing us that, the vaccines are safe for people to take. And of course, they're gonna continue to be studied. And but be careful of your source of information, because there's a lot of misinformation, unfortunately, that people are reading.
Okay, Chris?
Well, I agree with all of that. It's like people are saying I mean, I don't know. I don't really have much to add, honestly, to what Scune just said. It's just get vaccinated. There's the hesitancy. I get it. The long-term effects. People said the same thing with polio, meningitis vaccines. All legitimate questions. But at the same time, they looked around and saw people living with polio or dying from meningitis, and decided that's what I need to do, because I don't want to be that person, and I don't want to do it to somebody else by carrying it. And that's kind of where we're at right now. I think you have to trust the science. Keep in mind, polio was done in the early 1900s, and the science then and what they knew about viruses and bacteria was just really opening up. Now, this is the year we've gone to Mars. If we can't figure out how to make a vaccine correctly and know all of the pitfalls and side effects and how to avoid them from years of manufacturing these antivirals in any way, shape, or form, then I don't know when we're going to get it right. And I would say to people, the long-term effect is probably, as we speak now, 5 to 6 weeks away from you, because that effect is going to be, you're going to be in the emergency room wishing you had been vaccinated. That's all we're hearing about. All you have to watch is the national news, and every other news hour, they have someone saying, I wish I'd been vaccinated, because that's all you need. It's all you need.
Okay, Christian?
I'll answer mine in two parts here. One is based on what Chris said. Our staff constantly tell me all the time in the ICU how many times the patients have said, "I wish I'd gotten shot." Doesn't help when you're going to deteriorate. Secondly, I think going back to what Scune said, I have had a number of people who are hesitant. But when we gave them the information and we became the trusted source, then they took the shot. And so it's important that if you can't talk to your primary care doctor, talk to someone in your community who is an authority through your local board of health, a nurse, a provider, someone who actually can provide the actual science. You're not expected to read the peer-reviewed articles about it, but you can get information about it. And third, these vaccines, this technology has been used for about 18 years. So it has been used in other cancer-related care, and patients have actually fared quite well. So while COVID vaccines are still relatively new and we're still learning what long-term effects, what we do know is that the technology that has been used in other drug treatments has actually fared quite well. So my hope is that this will do the same. But I will tell you, getting the COVID vaccine sure does beat getting COVID and potentially being one of the long haulers that we have seen. We have a number of long haulers who can no longer work. So really getting vaccinated, it does vastly improve your lifespan as well as just your lifestyle by getting vaccinated.
Yeah, and back to what Scune was saying, one figure that I just looked at that I think backs up what you were saying is that hospitalizations among fully vaccinated individuals is 0.1% of the overall cases.
It is a very, 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 so many of the patients who come in who are hospitalized, none of them are in an ICU setting. Many of them have minor symptoms, but they're there for other medically related issues. But looking back at what's going on in Florida, Texas, Louisiana, where the volume of the surge of patients is so high that they're now turning patients away for other medical conditions. We are very fortunate in Massachusetts. We are not in that situation. And we do not want to get into that situation, but we must be mindful that there are only so many beds. And I think our staff throughout the public health, long-term care, acute care setting they're exhausted. And so what we're seeing is they are leaving the profession in droves. We are losing years and years and years of experience. And I think there's a lot of frustration amongst healthcare staff now towards folks who are not vaccinated. So the onus is on the unvaccinated to get vaccinated. I cannot stress enough how important it is to get vaccinated. And I'll agree with Chris. If it's just one shot, you know what? Get the one shot. There are so many opportunities to get it. It really is. It's your civic responsibility.
And Ron, I was going to say, Ron, to that person asking that question, 3 areas I would suggest that they look up, which can be found. You could Google it, or you can go right to the state website, which is the percent of fully vaccinated individuals who have had breakthrough cases, have been hospitalized, and have died. Look at those 3 statistics. And if you do, I think that will show those that are leery that it is in their best interest to get vaccinated. All right, Ron, what's our next question?
Well, actually, before we move on, it's a rare case when I feel like I'm qualified to answer a question that comes through here. So I'll take an opportunity there. And I want to touch on what Scune said. And, she astutely pointed out, be very careful of the source of information. And I thought that was brilliant because one of the things that I know from my experience in social media is that the same set of software that shows you what you want to see as you're mindlessly thumbing through entertaining videos of, animals riding unicycles and, people trying to climb milk crates and spilling, etc. Along that same algorithm is also one that tries to keep you listening to opinions that you are favorable to, that you've heard already. And in social media terms, we call it the rabbit hole. It means that, you further dive down into, you click on one piece of information that you think is interesting, maybe innocently, and you think, well, okay, this article was interesting. It talked about vaccine hesitancy. Maybe it had some scientifically backed up things. Well, the fact that you clicked on it, the social media platforms understanding that you have interest in that area. And while there's nothing wrong with digging in and getting your own information, there is a tendency to wind further down the hole, and you can find yourself on some serious credibility issues with the information. And I think probably 1 million people have written articles on how to spot those, but I think the ones that come true for me is one is if it strikes of political motivation. I would be wary of that. If there are politics mentioned and not science, I think that would be first and foremost. And then the second one would be if it's particularly contentious. So if there are things like shaming, and I will say, I think on the other end, for those of us that have been vaccinated and are out on social media and we're trying to, encourage others to be vaccinated, do so with the most caring and understanding heart that you can possibly do so. Like, vax shaming is not going to work with your friends. You'll push people further away. And I think that can also be an issue that I've, again, this is my observation this is what I do for a living. I monitor these channels, and it can be really, really difficult especially when you see friends and relatives taking that harsh approach. So I think if you soften the approach and maybe speak to your own experience, that's a way of encouraging vaccination.
Okay. All right. I know we've talked about the importance of getting vaccinated. 0 to 12-year-old population. When will we see a vaccine for them? Chris?
Well, honestly, anybody's best guess. It's going to be I think, from what I've been told, we're looking at mid-October. They want to get kids, I think some of it is to get the captive audience into the school buildings so that when they do release it, they know generally that they can get information back on how many doses they're going to need. It's a pre-set up to pushing the vaccine out. So I think mid-October.
Okay, Christian, you agree?
Yep, I do. I'm not sure that it's going to go down to, I predict that it's going to go down to as low as the age 2. I think many pediatricians, everyone is really hesitant to try clinical trials on any child under the age of 2. But I do think, I agree with Chris. I think they're coming very, very shortly.
Okay, Scune, you hearing the same?
Yeah, it can't come soon enough. That's basically my response. It's
Right.
we need to protect the unvaccinated kids, especially with this Delta variant and just the mortality rate and how just a little bit more complex that it is. So
Okay. Chris, those that have been vaccinated, when do you think we'll be calling on them to get a booster or a supplement, as you called it? What month?
I think what you'll see right now is just remember the initial rollout. We went to the immune compromised first, and then we went to the certain elderly age group, and then we went police and fire, and then we went to a next age group. It'll be much like that. And I think if I were to guess, I think they'll be pushing that around October, get a booster before the holidays kind of thing, just to kind of cut down the incidence of after the holidays, like we always see a rise in cases. So I think that probably is that makes the most sense. That would be then.
Okay, Christian?
So one thing I think, I agree with Chris. I think it'll go down, by age groups. I mean, we're now competing with booster shots, third dose shots. So I think that's going to be interesting. But I think, pediatricians have really been certainly in our own organization, have been really trying to sort out. There's this tension, should these shots be given in the pediatrician's office? We've also thought that maybe they should go to the pediatrician's office. They go into the schools, and maybe maybe the older kids can go to a larger mass vaccination clinic. But there is a debate about what is the best approach and where to give these kids their shots. So I think that debate is going on as we sort of just try to sort out really what is the most appropriate place.
Okay. Scune, I'm going to change gears and ask you the third rail question. Do you think vaccine should be mandatory?
my answer to that is
Are you there yet on that?
I think if you are very frontline, and you are, and I think it depends on your job and the kind of work that you do, and then also it depends on where you live, because we've seen there are range just across the country and all of that. But I think frontline folks that interface with the public, because you have vaccinated and unvaccinated people, I want to feel comfortable that whoever's serving me on the front line is vaccinated. I will feel more comfortable with that. So where I stand, it should be, if you are very frontline, public facing, people facing, that it should be mandatory. That's where personally I stand in that area.
All right, Christian?
So I'm going to go with mandatory. Mandatory because otherwise we will never get out of this. We will continue this for years and years and years until we get to a point where we have herd immunity. So I think, it is, again, like I stated earlier, it's a civic responsibility. When only half of us get it and the other half enjoys the benefits of those who did it, I think that's not a good approach. I think that for some things, I just think that this is the way we eradicate it. Get it done and move on so that future generations don't have to address this down the road.
And Christian, that's a straight up get vaccinated?
Yes, get vaccinated.
And if you don't, then you're out of a job, or can you get tested like some cities?
So I feel like we need to turn the tables now. I think we have done our best to, allow the unvaccinated to sort of enjoy that. But now we got to turn the tables because COVID continues to move forward, and there will be other variants, and they may become more contagious and more dangerous. And they could potentially put us in a situation where the vaccines no longer work at all.
Yeah.
So I do think that at some point, either you risk losing your job, you risk not being able to go into a movie theater, you risk not going into a restaurant. All the things that we enjoy, that should be reserved for those who are actually safe.
Okay.
And if you don't want to get it, that's fine. But I think there should be consequences for it.
Yeah. And Chris, over to you. Lastly, the thing that you and I have talked about, we just wish if this was going to happen, that it would be, something that would be across the board. Again, leaving us to try to figure it out when there are other cities and towns and counties and states not doing it, I think doesn't get us to where we want to go. I think you agree with that, right?
I do. I'm not a mandatory. I don't think
Yeah, you
anybody
never have that, right?
take medical decisions. They should be decisions, but
Right.
I think that enough information has been given to the general public over the last 18 months to 2 years on what your likelihood of your outcome is going to be if you're not vaccinated. Okay. And to Christian's point, there is some people enjoying the fact that other people are getting vaccinated, but keep in mind, whatever's coming down the pipe is going to come after the unvaccinated first. Okay. And those who are closest to you. Now, it's going to need a host that doesn't put up much of a fight. So it will pick an unvaccinated person. You may have a house full of vaccinated people, but that's when it's going to figure out how to get past the vaccine. It may not make them very sick, but on their way to the next family, the next family, the next family, you have a whole new variant that's drug resistant, and people are getting sick, and more than likely sicker faster and at different all age ranges, and the system would never take it. People would die hundreds a day. We saw that when our hospitals filled up. Had tents outside hospitals, had 50, 60 people a day in those things. It's not right anymore to not be vaccinated. I don't want to, like Ron was saying, I don't want to shame anybody into it, but no one can say to me with a straight face they don't have enough information yet, or that a certain political party wants me to act this way or that way. I wouldn't go that road. I would go what is best for you, your loved ones, your kids, your nephews, your relatives, anybody you come in contact with. You're putting them at risk. More than likely, you're putting yourself more at risk, because if a vaccinated person is positive and they're more than likely asymptomatic, they're going to get a lot of unvaccinated people sick. That's how it happens. And these people wading into the concert thinking it's all good, trust me, it's not. You might have got away with it once. You won't get away with it twice.
Okay.
All
right, good discussion.
Only so much.
So we've got a couple more.
Yep.
Yeah.
And
So
can you tell our panelists the clock? What do we have? A few minutes?
yeah, sure. So we're looking at about 10 minutes. We usually like to leave a couple of minutes to wrap up at the end. So I think we have probably time for, 2-3 more questions. I just want to acknowledge that Jane Brown, who asked a question on UMA's YouTube feed, we kind of covered it in the previous discussion, but I'll let you elaborate, Mr. Mayor, was basically whether or not Malden intends to follow suit with the city of Boston regarding the announcement of requiring, municipal employees. But I think you just touched on that. Essentially, you're waiting on, the state, right? So, but I'll allow you to go from there.
Yeah, no, I think you hit it right. We have been meeting internally on this. We have not reached a consensus. I think what we would hope is that there would be some kind of guidance from the state that would have all of us included in that decision, because we know it is a decision that is not to be taken lightly. There are people that have already expressed to us their weariness of that, and there are others that have said, yeah, full steam ahead. So as always, we try to build consensus before we announce anything, and that is most definitely the case with mandating vaccines for municipal employees. So stay tuned. We will keep you posted. This show here this evening will be replayed throughout the weekend, and we'll go from there.
Okay. Our next question is with respect to those that are in the ICU, what is the percentage of those that are, I guess, associated with either under the age of 40, so on the older side, and with comorbidities? Is that, we've talked about the vaccine, but is it still consistent as it was pre-Delta that most folks that are ending up in the ICU are either on the older side or with comorbidities?
And that's to Christian, Ron?
Yeah, we'll start with Christian. Yeah.
Interesting. We did not see a lot of elderly people through the first surge or the second surge, and even this round, we did not see a lot of older people. We saw a lot of younger people. The youngest person I think we saw was a 22-year-old. The oldest was 56. So many of the folks that we did have in our ICUs were probably, I would say, the median range was probably sometime in their mid-30s. So
Ron, let me stop you there. Christian, so let me ask you, the difference is the variant, right? Because COVID-19 itself, it was pretty widely accepted that it was reaching more of our elders than it was the younger people. But this time around, it's because the virus has advanced and this variant is reaching down to the younger population. Is that why?
Well, so I wouldn't say that it's advanced. I would just say that it's mutated differently, and so it's become more infectious. So right. I think during the initial round, one person could probably infect probably 5 to 9 people. I think the Delta variant is showing that it can infect about 1 in every 2 or 3 people. It's about as contagious as chickenpox. So it is getting to a younger population. I think that there are a number of people, particularly you saw in the nursing homes, where I think they affected the elderly. We did have a number of elderly people who ended up losing their life on the medical surgical units, but in the critical care units, we had people who certainly probably we thought probably had a chance until they succumbed to the disease. So this is not an older person's disease. This is very much the entire lifespan.
And I think the second half was the comorbidities part. So is that still consistent? Are we still seeing most of the folks that are in that ICU or even, or close to death, or is that still mostly those with comorbidities, or is it even surpassing that now? We used to see certain comorbidities, obesity, diabetes. Believe it or not, asthma was not one of them. We would see consistent comorbidities in many of the patients. We are not seeing that now. We are seeing very much people who are healthy, who are getting COVID and are on a ventilator. So they are on a ventilator. I would not say, though, that our ICUs at the moment, at least in Eastern Massachusetts, based on today's discussion, they don't look anything like what you're seeing in Texas at the moment. What I would say, though, is that the patients who do have COVID, who are in the intensive care units, are the unvaccinated. But there are other patients in the ICUs who don't have COVID and are there for other medically related. What we don't want to get to is we don't want to get a situation where now the ICUs are now becoming basically COVID units. That's what we do not want. And so all efforts should be made to try to avoid that as best as possible. And the best way to do that is to get vaccinated.
Scune, based on our discussion this evening, would you travel?
It depends on travel to where. So I think if it's a COVID hotspot, like if they have really high transmission rate, I wouldn't feel comfortable traveling there. If they have low vaccination rate, I would not feel comfortable traveling there. But if they're like 80 or more and then they have mask requirement and taking the precaution, yes, I would travel to that. But places where I know that I would I would risk catching a breakthrough case and all of that. Probably not.
Okay, and Chris, should people start rethinking fall events?
I think so. Yeah. I mean, from what we can tell, we're gaining about, exponentially cases are going. And there have been no super spreaders that I've been made aware of, but I think that's only because the CTC is not fully staffed yet. That's the agency that does all the close contact contact calls. Restaffing right now. And that's a key feature for me. And as I know, told you, Mr. Mayor, that 200 new employees going to CTC, we need to start watching our P's and Q's. And that's when we had started out long meetings on how we want to go forward and who we need to get involved and make sure that everybody's getting the right message correctly the first time. And I'm all on board for that, and I'm looking forward to the completion of these talks. But that's where I'm at. I think I would question anything down to a barbecue, unless I should say I went out for the first time last Tuesday with friends, and the first question I asked was, before I said it, my friend said, "We're all vaccinated," because they know what I'm going to say. I would have turned on my heels and left and said, "Nice seeing you, but I gotta go." So I would say yes. Use your best judgment. Know who you're with more than anything else. If you don't know everybody who's around you, you're probably putting yourself at risk to become at least an asymptomatic carrier.
Okay, and Chris, just to clarify, so that's a hunch on your part right now, nothing official, but
No.
you're suspecting that there will be some change in event gathering in the fall.
I do think if the CTC keeps staffing up, that's what tells me what's going on in other parts of the state. It's a simple, you know what I mean? Can ask anybody that question and they'll give you the answer. So that's why I'm kind of following that. As that ramps up, I think every measure we take should ramp up as well. And right now, it's time to start watching who you're socializing with again.
All right, very good. So we have just a couple minutes left. As Ron mentioned, we do want to give you an opportunity just to help us close out the show. So we'll begin with Christian.
Well, I want to thank you, Mr. Mayor. Nice to see Chris and nice to meet Scune. And I want to thank the residents of Malden. I think you're all doing a great job. I think we got more to do, as we do with any other community. But I will leave you with this. I think if you believe that the pandemic is almost over, or you think you can write this out without getting vaccinated, this virus will find you. So it is important to take the proper steps now. While this is no cost, it costs you nothing to get vaccinated, but you can lose your entire life savings in a hospital ICU, and it's not worth that risk. So I would just ask everyone, please take the opportunity. If you don't know, if you're reading information off Facebook, please contact the local health department, contact someone who is an expert, who is authority on the subject, and ask your questions so that you are given the right information. It's so critical at this juncture.
Scone?
Thank you again for the opportunity to talk to the city of Malden, and thank you for everybody who tuned in. Again, just wanna, we are where we are right now with the reopening and enjoying downtown and not wearing a mask for a little bit because of the people that got vaccinated. And we want to continue to enjoy aspects of the city of Malden and seeing our friends in that way, so we don't go back to that quarantine piece again. So if you have not been vaccinated or are still hesitant about the vaccine, talk to a trusted person, talk to your primary care. And then if you still want to find out how to get vaccinated, talk again to your doctor. I believe Massachusetts has a Vax Finder where you could figure out where you could get vaccinated. So think about it and talk to the trusted people in your community so we could get to a point where we could protect not just grandma, but also the kids that are not even eligible to be vaccinated yet. And thank you for tuning in, and thank you, Mayor Christenson, for inviting me.
Very good, thank you. And Mr. Webb.
Again, get vaccinated. As I sit here listening to all we've talked about tonight, the one thing that keeps ringing in my head is that those who aren't vaccinated are really just so close to ruining it for those who are vaccinated. They're eating up the clock, right? Everybody that got vaccinated in the last few months, now the clock starts ticking on how long your vaccine is going to last. It's going to last as long, hopefully, as it takes to get everybody vaccinated. But we don't know that, right? And that's kind of what we're seeing. It's an attrition rate in the opposite direction. And I'd like people to think about that, because the longer we wait to get vaccinated, the less strength the vaccine has for your mother, your father, your aunts, uncles, grandfathers, grandparents, and your children, more than anything else. More so now than ever, your children. And I don't want to lay that at anybody's feet, but that's really where we're at. It's incumbent upon you. Get vaccinated. You're ruining the process in so many ways and taking risks that are so incalculable that, a lottery ticket looks like a good deal next to that. Okay. Be well. And if you want to reach me, I can be reached at cwebb@cityofmalden.org, or you can call the office at 781-397-7049. Thank you.
On behalf of our panelists, Urban Media Arts, Ron Cochran, I'm Gary Christenson, Mayor of the City of Malden. Remember, this is a marathon, not a sprint. Let us move forward together. Thank you, and good evening, Malden.